So we've talked about scene safety before. This is something really, I think it should be first, second, third, and last, all the way through there. Scene safety is a big deal. You want to take care of yourself and then your partner, other rescuers and bystanders, and then the safety of the patient. You're also going to ask, do I need any additional resources? Do I need any other EMS units? What if you have 6 patients? You definitely need to get some extra help. Maybe you need law enforcement. Maybe the patient says that somebody mugged them, that they were the victim of a crime. Maybe you're just not comfortable with the patient. Maybe the patient's making threats. Get law enforcement out early. Sometimes it takes them a while to get there. Do you need the fire department? And this can be from anything for there's a fire. It could be that you need help lifting the patient. It could just be that you have a really, really sick patient and you need the extra hands for medical support. Is there a hazmat? Do you need a hazmat team? Do you need a negotiating team? Is there a hostage going on? Do you have somebody who's suicidal with a weapon? Whatever else you might need. The important thing here is to be familiar with what is in your area. So with the available resources. And that way you know what's available so you can call them out when they're needed. The next thing to consider, actually this again should be up with really one of the first things to consider, is body substance isolation, or BSI. You'll hear me say BSI pretty much all the time because there's a lot of syllables here. So BSI, body substance isolation. Gloves, every patient. Eye protection, most patients. Although you will see providers not routinely wearing it, it's a good idea to get yourself a good set of eyeglasses, basically. They're safety type glasses. They make some that aren't really awful looking. You can get some that look okay. But it's useful to have. You never know when a patient's going to spit at you, or when something's going to splatter, or when a patient's going to puke in your lap and have it splatter up in your face. People don't really think about their eyes as a place that body substances can enter, but if a patient spits in your eye and they have some sort of disease, it can actually be transmitted through the eye. So eye protection is a good idea. A mask, generally speaking, if we have a respiratory patient, somebody who has tuberculosis, anytime you have a patient who's coughing, sneezing, sometimes if they just really spit a lot when they talk at you, you may consider putting a mask on because you don't want to get whatever bug they have. The last one that we commonly see is a gown. The problem with gowns is they're tough to move in. One of the things that we have to do as EMTs is move around a lot, move patients around, and gowns kind of get in the way of that. So these are generally reserved for childbirth or a particularly bloody mess. If your patient has a GI bleed and they're puking everywhere, you may consider putting a gown on. If your patient is a major trauma and you have time to put a gown on, that's going to help keep the blood and whatever else off your clothes. Childbirth, definitely. We almost always have time to put a gown on for childbirth, and it's worth it because there's a lot of body fluids involved in childbirth. Don't forget protective clothing. If it's cold out, dress in layers. You may end up out on a scene for hours. And it may seem like 40 degrees, which is kind of what it gets to around here in the afternoons in the winter, may not be that cold. But when you're out in it for hours and you have no gloves on, you're going to be really cold. Turnout gear. Some places around here will issue you turnout gear. This is not the same thing as fire department bunker gear. No, it is not fire department bunker gear, but it looks similar. And it's designed to protect you against like a flash explosion, and it's also designed to protect you against jagged edges, glass, and that sort of stuff. So it looks similar to fire department bunker gear, but it's not. It's a little bit different. It does provide head-to-toe protection, although it doesn't really do anything to cover your face. You do have a helmet, a jacket, pants, and boots, usually with that. So you still have to have eye protection and potentially something to cover your face. Gloves. So when we talk about protective gloves as opposed to BSI gloves, so we have the latex or the latex-free style gloves, hospital gloves. There's also leather gloves that you may need to use if you're moving equipment around, or extrication type gloves that have padded knuckles. They have kind of grips on them so that you can hold onto things a little bit better, but they help protect against bumps and scrapes on your hands when you're getting people out of a vehicle. You can usually substitute leather gloves for the fancy extrication gloves. Some manufacturer, I'm sure, would love you to spend $50 or $60 on a fancy pair of extrication gloves, but realistically, leather gloves work just as well, and you can get those for 10 or 12 bucks at the local hardware store. Helmets. So again, this may be issued as part of your turnout gear. It should be worn in anything that's considered a fall zone, so this could be a construction zone. If you see a bunch of people wearing hard hats, you should probably put a helmet on. Boots. So you should have boots anyway. They should have either a steel toe or a composite type toe, so basically to give you toe protection. Because I'll be honest, I probably was protected by my steel-toed boots every shift I was working. Between the stretcher rolling over your boots, dropping things, tripping over things, boots are really important. Spend the money. They're expensive, but spend the money on a good pair of boots, because they do last. Eye and ear protection. So keep a set of earplugs with you, and again, keep your eye protection with you. This should be used on rescue type operations because that stuff is loud. Those tools are loud, and even the sirens are loud. Though admittedly, we can't wear hearing protection while we drive, but some ambulances do have little headsets. They look like little headphones, and you wear them, and they keep your ears protected. Sun protection. Don't ever forget about this. Again, consider the fact that you could be out on a scene, for hours. Keep some form of sun protection with you at all times, and that way you don't have to worry about, oh gosh, I forgot my sunscreen today, and you go back and you're sunburned, and then you still have, 12 hours left on your shift where you're going to be in pain, having to carry the bags, and that sort of stuff. So use sunscreen.